Welcome to CUNY TV presents COVID-19, a crisis in motion, a virtual town hall meeting. I'm Mike Gilliam. While there have been signs that the number of coronavirus cases has been plateauing in our area, the death toll has continued to mount. The pandemic has also disrupted the lives of everyone, including the CUNY community. We have a good group for our town hall. Dr. Bruce Y. Lee is a member of the CUNY Coronavirus Task Force and an expert on the virus. He's also a professor of health policy and management at the CUNY Graduate School of Public Health. To help walk us through emergency funding for students, we have Angie Ciampa. She's the University Dean of Continuing and Workforce Programs. We also have 4 CUNY students who will be joining the discussion and posing questions. Welcome to Amelia Nygren. She's an international student from Sweden studying journalism and political science at Hunter College. And welcome to Michael DiBartolo. He majors in communications at the College of Staten Island, where he's also pursuing a minor in film. Gabriella Vetrano is here. She's a junior in Macaulay Honors at Hunter College. And welcome to Sylvia Barona. She's a senior at Baruch College, majoring in business communications with a minor in Latin American studies. But first, we want to bring in Anthony Ciampa. Welcome, Anthony.
Hi, thank you, Mike.
Thank you. Anthony is a registered nurse and first vice president of the New York State Nurses Association. It's good to have you with us.
Thank you.
Tell me, what's the situation in the hospitals now that the numbers have plateaued?
So we're still experiencing a tremendous strain as we buckled with the increased amount of patients that came into our system. PPE is still lacking. We hear a lot about the masks and gowns that are that we've been short on. We're still getting reports from our nurses that we're using N95 masks for days, and the level of PPE we feel is not sufficient to protect us, especially under the guidelines set forth by the CDC. We're still exposed and feel that we're coming into contact, with our skin and our clothes, and there's mounting evidence that the disease is airborne.
One of the questions I wanted to ask you, Anthony, though, is what does it look like in the hospitals at this point? Have things plateaued, or are you seeing the same or more people coming in?
Yeah, things seem to be slowing down, but you have to remember that the patients that come in are incredibly sick and they're requiring greater lengths of stay than we're used to. So we're currently working, on trying to get these patients better and out of the hospital, but we're completely, strapped within. Our patient care loads are doubling. In the ICUs, we're seeing nurses take on, when it was typically a 1-to-1 ratio, 5 upwards to 6 patients, and doubling those numbers in the emergency rooms and on the med-surg floors. Nurses are also getting, as well as other frontline healthcare workers, we're also getting sick and continue to be exposed as we try to do the work before us.
What would you like to see the city, state, and federal government do at this point?
I tell you, one of the things I'd like to see is greater enactment of the Defense Production Act so that we can get those mask, gowns, N95s, and other things, including vents, ECMO machines, and pumps. One of the things that are not talked about is the level of intensive care that these patients are requiring, up to 5-6 pumps per patient. We're scrambling to get our hands on those resources. And what I would like to see is the Defense Production Act really utilize an all-hands-on-deck strategy that was used in World War II, where we get everyone to manufacture what we need, not only in New York City, but for the country. And why that's not happening right now is beyond me.
Okay, we're doing some things at CUNY, and we're going to talk about that a little bit later in the town hall. In the meantime, emotionally, what impact is this having on the nurses in the hospital, nurses and doctors?
Yeah, this is taking an incredible toll on the workforce, on the nurses, the doctors, and all healthcare givers, mentally and physically. We're just not used to seeing the level of acuity that's coming in, nor the amount of patient deaths. Of course, family members are not really able to be with their loved ones during these critical times, and we're the only ones. So it's taking a tremendous strain on mental health. There are counselors and other programs, but we'll have been to war, and there are both short and long-term consequences, as we know in New York City when we rush into a disaster.
Okay. Anthony, thank you very much for all that you and your colleagues are doing. It's a very difficult time, and you guys are the front line for us on this. Thank you.
Thank you.
Okay. Dr. Bruce Lee, you guys have recently done another survey. Tell me about it.
Well, we've been continuing to look at how what's happening in terms of people's losing jobs, and in terms of people's mental health responses to the pandemic, as well as how people are getting information about the pandemic, on social media, and television as well. And so initially, people were getting a lot of social media information and immediately passing it on, but I think people are becoming a little more judicious in terms of that. So, the survey continues to show that, number one, people are being affected significantly by the pandemic in many ways, ranging from mental health to job status to socially, and that all of this is disproportionately affecting certain communities and certain demographics. So we're seeing lower income communities, more disadvantaged communities, ethnic and racial minorities being disproportionately affected by this pandemic.
Okay. The White House has issued guidelines now on when we could go back, when things could be reopened. It's a three-phase plan. What is your reaction to that plan?
Well, the plan is fairly general, and so it doesn't have some of the specifics that I think would be important to know. It does mention that, okay, in order to quote unquote reopen or relax social distancing, you need to demonstrate during a 14-day period a consistent decline in cases, and of course that's consistent with what public health officials are recommending, because if you see a decline over like 1 or 2 or 3 days, that can just be variability in the data. Like, we don't really know how many cases are actually occurring because there's no widespread testing that's occurring. So and then it talks about how the governors and a lot of local officials will determine whether to quote unquote reopen businesses, et cetera. So it provides very general guidance, and it is consistent with what the science suggests. But the issue is the details, because number one, a big issue is testing. So how are we going to really figure out what's happening with the virus if there isn't widespread testing? So how are we going to make testing available, and not just testing when someone actually is infected with the virus, but the other type of testing is serology testing. So basically checking your blood serum to see if you have antibodies and you may be immune. That's really important. And there's not very clear guidance on how that's actually going to be rolled out and done in a large scale basis.
Let me ask you a question. What do you think absolutely needs to happen, regardless of what the feds, the state, the local government does? What needs to happen before CUNY could reopen?
We really need to have a better understanding of where the virus is and who's infected and who's immune. So that all relies on testing. It's basically the equivalent of if you're playing a basketball game or a soccer game or a football game or whatever, you have to see the field. You have to see the opponents and the field. And in this case, the opponent is the virus. So if you have no idea where, who's infected and who's immune, you're not seeing the field. You're only seeing part of the field, and it's very difficult to make decisions without that knowledge, because the issue is if you reopen CUNY or other businesses and other organizations, it only takes a few people who are infectious, and you have a wide swath of people who are susceptible to virus. You can have a major surge in cases once again. So we really have to come up with a strategy on how to test people, how to collect that information, how to disseminate information, and also how to determine, do we feel confident that people who are exposed are truly immune to the virus? Yeah, that's another big question. Can you get infected another time? And these are scientific questions that need to be answered at the central level. In other words, we have to say, okay, these are the studies that are needed. We need to get this information, and the entire nation needs to hear this information.
Okay, I'm going to go to some of our students at this point. Amelia, you were scheduled to graduate. Now that graduation ceremony is not going to happen. How are you holding up? What's your reaction to all this?
Well, I'm more worried about getting out into the workforce in this economy, really, rather than having the graduate ceremony, even though my family was going to fly in from Sweden. And I was very much looking forward to that. But it's really more on the job front that I'm worried about right now, because so many people are losing their jobs and internships are being canceled, and so many things are just so uncertain at this point. So that's really my biggest worry at this point.
Mm-hmm. Maybe we should go to Angie at this point. Angie, are there some things that are going to be made available for students to kind of help them through this?
Sure. Thank you, Michael, and thanks to all of the guests and the students. So a couple of things that I wanted to talk about. So I'm a university dean for continuing ed and workforce programs. And so last week we launched the Chancellor's Emergency Relief Grant, and we were able to help support this week 2,000 students to get emergency relief grants to really help with the whole varieties of losses that we heard from Anthony and from Professor Lee. So job loss, fooding and housing insecurity, student parents. There's just a lot of curveballs that have been thrown to our students. And so we're really pleased to be able to offer some financial assistance. And we are going to continue to release grants to students as we continue to fundraise. We hope to raise about $10 million through the grant program and then continue to meet the needs of our students. We're also pleased that the CARES Act, the federal funding, is able to support, it will be released in terms of emergency grants to students over the coming weeks. And we look to really support tens of thousands of students with emergency aid. In terms of Amelia's point around kind of job and job loss, we are keeping a really close eye on the workforce in terms of essential workers, face-to-face workers, and remote workers. We are seeing that probably in the New York economy, about a third of workers are keeping up with remote work. And we are also seeing with a number of employers internships that are carrying on, but remotely. And so we are just really wanting to understand as the economy sort of starts to settle a bit, how we can get resources out to students around mentoring, around professional development, around upskilling and training, and clearly around job opportunities. And so those are some of the resources that we have that we are both implementing right now and that we look forward to implement.
Okay, great. Thank you. Now, we mentioned a shortage of protective gear at hospitals. Well, CUNY is stepping up to kind of help out. The Chancellor, Felix Matos Rodriguez, recently released a statement saying that in a crisis, institutions like CUNY have a moral imperative and responsibility to mobilize. Now, he went on to say, CUNY is harnessing its powers of innovation to supplement the city's PPE supply chain and aid the brave healthcare workers who are putting their lives on the line. There is no greater cause at the moment, and we are proud to stand with New York City and do what we can to help those on the front lines of the war against COVID-19. Now, we want to bring in Mike Lawrence from the Engineering and Technology Department at Queensborough Community College. Mike, welcome.
Oh, thank you. A pleasure to be here.
It's good to have you here. Now, you guys have been helping out with masks, right? And using your 3D printers, correct?
Sure. What our situation is that we have a fairly significant laboratory. In fact, as we were talking, I was just on the line with Elmhurst Hospital. They were telling me about a partnership they want to do with the Boy Scouts, I guess, with assembly, and we're going to help them 3D print. I don't know a lot about it, but the point is that's typical of what we're trying to do. What we're trying to do is say, we have a lab. Of course, we're not at 100% because we don't have personnel. We're under lockdown, as everybody is. But to the extent that we can be helpful, anybody that has a request, we're going to certainly try and help them. So there are two things that we've done so far. The Stony Brook School has been working with Stony Brook University and supplying Stony Brook University Hospital. Their goal was 5,000 shields. And the young people over at Stony Brook School came up with a fantastic design that instead of 3D printing, it could actually be cut on a laser cutter and engraver. So they sent us some plastic, and we actually cut out about 200 units for them.
Wow.
And now they found a lot of manufacturers on Long Island that will help them with this, and they're going to be able to reach their goal fairly quickly. Now, the thing is, the difference between laser cutting and 3D printing is time. I have a very, very capable industrial 3D printer, but it takes the better part of a week for me to produce 40 of the headbands for the face shields on that.
Mm-hmm.
Okay, about the laser cutting, in about, I guess I spent maybe 2 hours. I was able to do 200. So what's great about this is the innovation, all the people across the country getting involved in maker things. And as I said, I just got off the line. In fact, I had to end the call with Elmhurst Hospital to take this call, and I'll be calling them back to get more details. But she was just telling me they're going to do a partnership with the Boy Scouts, and we're going to help print some things. And so I was telling you, anything we can do to be helpful. And that's the same relationship that we have with Memorial Sloan Kettering Hospital.
CUNY actually is doing as well. They've organized a number of the different campuses and taken the 3D printers, and they're doing that. I want to bring in some of our students here at this point and just get some of their questions answered. Let's first go to Gabriella Vetrano. Gabriella, what do you have? Do you have a question?
Honestly, the biggest question I have is something you brought up earlier. It's just a matter of, I'm a junior right now, and what's really on my mind is how is CUNY going to proceed with regards to the fall. I know so far summer classes have been moved completely online, but yeah, going into my senior year, what the fall, if anyone has an idea of what the fall semester will look like.
Yeah, Dr. Lee, I want to piggyback on that. Also, do you even see dormitories as being viable in the future?
Yeah, again, it all depends on our understanding of where the virus is spreading. And really mapping that out. If there is the risk that the virus is still circulating in the community, the concern is that if classes reopen or dormitories reopen, and then you have a whole group of people who may be susceptible, that actually may cause a major surge in cases. And I also want to add that it's really important, you know, these are some points that Anthony alluded to. There has to be coordination with the healthcare system too. You know, one of the tenets is that the healthcare system has to be ready and has to have available capacity to handle cases if they do surge.
Sophia Barahona, do you have a question?
Yeah, so in regards of like still with CUNY, not a lot of programs are like, for example, for seniors, right? They're graduating. So since they can't do like their internship anymore, they offer like professional development services. Is CUNY gonna maybe like extend that for students who may be graduating right now, but you know they're not able to get a job? So can they still like manage to like get services like Baruch, like we have the Start Development Center, right, to like get jobs maybe for extended time after graduation?
Angie?
I'm happy to jump in. I think that is an excellent suggestion, and we've absolutely been really thinking about current students, recent graduates, and kind of even incoming students as really important groups. Our hearts go out to recent grads, but I want to also give folks hope that there are, you know, hiring might be slower, but hiring will happen within the kind of caring economy, which is kind of an area that is kind of the bread and butter of CUNY. Within business and finance, within tech companies, we are seeing it's slower, but we are absolutely seeing hiring. And so we are going to be thinking about how we can very concretely work with this new set of graduates and extend those services. That's really critically important. It's our mission and it's our duty to do that. And right now we're sort of developing a playbook for how we can remotely offer counseling, mentoring, and other types of professional development to recent grads as well as current students. So stay tuned. We have a lot of information on the Continuity for Students website at cuny.edu. And we hear you, and we're working as quickly as we can to amass the resources and real help.
Okay, Michael
Yes.
DiBartolo, what question do you have?
Well, first, I would just like to say that as an Eagle Scout, I'm very glad to hear that Mr. Lawrence is working with the Boy Scouts to help develop masks and whatever personal protective equipment we could do as a community to really help those on the front lines. But ultimately, I a lot of my concerns are the same as my fellow students in terms of jobs. I'm a senior as well, so I'm glad to hear that CUNY is developing a plan for that focus.
I wanted to ask you a question, Michael. Are you doing distance learning?
Yeah, all of my classes are online now. I'm working from home as much as I can with my jobs. So pretty much everything that I've been doing down the line has gone remotely.
And how has that been working out for you? Has it worked out okay?
Really great. We had a meeting yesterday, and we are trying to see if we can get some grant funding from Rotary International, and trying to help out some of our small local businesses, as well as our community health action programs on Staten Island.
I want to go back to the front lines. Anthony, what do you see happening in the future?
Well, that's the big question. Our focus goes to, primarily, meeting the needs to protect our workforce. I would like to see widespread testing, be prioritized to the front line. Right now, where very little testing is being done. And certainly it seems to be only the symptomatic workforce is being tested. But, my mind also moves towards having the healthcare system being able to meet the needs of the future patients that we anticipate coming in as this plan is being developed to, release people out of their homes in phases. So we want to make sure that that's done in such a way that the hospitals can handle the anticipated influx of patients. This disease is so highly contagious. It seems that we're going to be depending on herd immunity and the expectation that most people will get infected until a vaccine or a very good, viable treatment is developed.
Yeah, it's frightening times. Dr. Lee, I want to ask you a couple of questions about life going forward at CUNY. What about the dining halls? Do you expect that we will ever be back in the dining halls the same way that we were prior to this? And also, do you ever think that we'll see as many people attending live classes as we did pre-COVID-19?
Yeah, as Anthony referred to, the real key things are, beyond, we're doing social distancing to flatten the curve, and of course, tracing and isolating will be key to contain the virus. But the big game changer will be having a vaccine, if a vaccine can be developed, and accelerating that development, or a specific treatment. Because once that happens, then you can confer immunity to people, and then the virus becomes something more like the flu, if it's seasonal, or other diseases where we have vaccines to protect people. So this really highlights the importance of vaccination. And over the past number of years, we've sort of, a lot of people in society have gotten away from understanding how important vaccination is. It is a complete game changer. This is the situation we would have to deal with all these other diseases if we didn't have vaccines for them. So if we're able to really generate a vaccine and then distribute and get people vaccinated, then that will allow us to return to what society was previously. So that's certainly possible, but it really depends on that happening.
Okay. Do you think we will ever get back to a kind of normalcy in the fall, if in fact there is no vaccine, because it's going to take some time to get that?
Yeah, the concern is, of course, what will happen with the virus. So there's several possibilities. One possibility is we might see activity decrease a little bit during the summer, like June and July, if it does follow the course of other types of respiratory viruses, because we do know that respiratory viruses like the flu, and I want to emphasize this is not the flu. It's very different from the flu, but you do see respiratory viruses go down in activity because potentially the humidity increases during the summer, and that may make respiratory droplets smaller. But the concern is that even if that does occur, and we're not sure if that will occur, even if it may remain level or even go up during the summer, when the fall comes and when the seasons change, there may be more of a surge again occurring in the fall and winter. The other concern is that if there is mutation of the virus and you actually have another strain circulating. So all of these are concerns coming to the fall. So at this point, until we have more information and are more convinced that the virus is no longer circulating in the community, we have to brace ourselves and accept the fact that things are not going to return completely to normal this fall. And we actually have to be prepared to potentially, ratchet up social distancing after, during the fall, if all of those things are problems.
Thank you. It's been a tough 5 or 6 weeks for all of us, but this has been a great conversation. And I hope that we've been able to answer some of your nagging questions about the coronavirus and how it's affecting life at CUNY. I want to thank all of our guests and our students for taking part. And thank you very much for joining us. I'm Mike Gilliam. And for now, remember to stay home, stay safe, and wear those masks. Thanks again for joining us for our town hall meeting. CUNY TV presents COVID-19, a crisis in motion.